Each month on Smart Medicine, we give you the chance to ask the expert. This month's topic, inflammatory breast cancer. Joining me now, Baptist Women's Health Center radiologist, Dr. Elizabeth Glenn. And Dr. Glenn, thank you so much for joining us.
You're most welcome.
Tell us what the difference is between breast cancer and inflammatory breast cancer.
Breast cancer and inflammatory breast cancer are actually diseases of the same cells, but the presentation is different in inflammatory breast cancer. The cancers that occur in that clinical presentation are much more aggressive and they spread faster. So a woman often doesn't have the usual lump that she'll feel with a breast cancer.
So what are some of the symptoms of inflammatory breast cancer?
A woman will have rather sudden swelling of her breast, usually over weeks to months. She'll notice that her skin becomes thicker, more edematous, and she'll probably also see some of the skin, the swelling, turn red.
How is it treated?
The treatment of all breast cancer, the primary therapy of all breast cancer is surgical removal of the cancer. There are also extra treatments that a woman will receive, and they're called adjuvant therapies, extra therapies. In the case of inflammatory breast cancer, surgeons used to have a terrible time curing the cancer, doing surgery first and then trying to do the adjuvant therapies after. And there was a wonderful change when chemotherapy was applied first. In the case of an adjuvant therapy applied before the primary therapy, it's called neoadjuvant. So neoadjuvant chemotherapy has really changed the face of inflammatory breast cancer.
Are there certain women who are more at risk for inflammatory breast cancer?
It tends to occur in younger women more frequently, although one can see it in older women as well. It also tends to occur to a greater extent in African American women, and then there are certain geographic areas of the world that seem to be more heavily affected. But let me point out that inflammatory breast cancer is a very small segment of the breast cancers that we see. It's only 1 to 5% in this country.
Dr. Glenn, thank you for joining us.